Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're discussing the ins and outs of joint replacement surgery, a procedure that, due to medical advancements, delivers the necessary results without the dreaded downtime.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Dr. Brody McCoy. You are now becoming a regular on our show.
Well, I'm glad to be. Glad to be one.
So today's topic is outpatient joint replacement surgery.
Sure.
First off, tell us what that's all about.
So joint replacement surgery is where we either have a hip or knee replacement, where traditionally people have come into the hospital and still do a lot now and have their joint or their hip or knee replaced. When I first started doing this, 15 years ago, people would stay in the hospital for 5 days after having a hip or knee replacement. That's come down considerably as things have changed. The technology has changed and allows us to do this in a much more minimally invasive procedure now, much more tissue preserving, tissue sparing procedure than what was done in the past. Pain control is so much better now. I mean, we use a multimodal pain regimen, so the anesthesiologist is involved. We do a lot of blocks. They do a lot of blocks for us. Meaning just numbing up certain portions of the body that we're operating on. That allows a much quicker recovery than was done in the past.
So you spoke about this with the whole pain management. We hear in the news all about that.
Yeah, sure.
How do you work with patients to make sure that they're...
So yeah, great thing. So there's a lot of medications that are used. We do a lot of I use a cocktail, if you will, I do injections around the knee, around the hip, that has some long-acting anesthetic medications in there that give prolonged pain relief. We try to keep people off opioids. I mean, you've heard plenty about this opioid epidemic. We minimize opioids. Most people that have hip and knee replacements need minimal pain medicine afterwards. It's only a short period of time. So we're able to do that by doing a spinal anesthesia, just like when a lady has a baby, the legs go numb. We can do our hip and knee replacements where the patient stays awake and their legs go numb. It allows us to do the surgery in a much safer and well-controlled manner.
And I might be speaking out of turn on this, but a lot of times don't they feel so much better after they get the surgery than they did before they went in?
So somebody that has very bad arthritis, I tell them you'll have some pain after the surgery. It'll be post-surgical pain, but that's completely different. People that have been dealing with bone-on-bone arthritis for years, that pain will be gone and they can get up and move a lot quicker. So that's allowed us to get to the point of doing some outpatient surgery. I mean, the hospital is a great place to have your surgery done, but patients that would like to get home as soon as they can to continue the recovery process. So we're able to get them home much sooner with the surgery that we're doing now.
And thank goodness for technology.
Oh yeah, it's advanced a lot.
And so people at home are probably wondering about the risk. Are there any?
So yeah, the risk of surgery, there are small risks with surgery, and there are only certain patients that we do outpatient joints on that go home the same day or the next day. They have to have good medical condition, good care at home, healthy, not a lot of comorbidities. By that I mean other diseases going on, heart disease or diabetic or something like that may preclude them from having an outpatient joint. We could still do it as an inpatient, just have to watch them a little bit closer. But it's a very, very successful thing to do. The risks are real small. I tell patients the two big risks you worry about after any joint replacement are risk of infection, which is about 0.01% chance of that. We give you antibiotics before and afterwards to try to help minimize that. I mean, East Cooper's got the lowest infection rates by far in town. So it's a very, very good hospital to have your surgery done. And then the risk of blood clot. So the risk of blood clot is about 1 in 750,000. We can take that number to about 1 in a million by just taking an aspirin, just over-the-counter enteric-coated aspirin, 325 milligrams, once a day for 3 weeks, along with early mobility. The quicker we get you moving, the better.
You gotta get up, right?
Gotta get up, gotta move.
Okay, before we go, the joints that can be replaced or that can be outpatient.
So shoulders are very easy to do as an outpatient because the patient gets a block at the base of their neck, which lasts for about 3 days. So those patients do extremely well. We did 2 of them yesterday, no pain after surgery. They do very, very well. Hip replacements are very easy to do as an outpatient. Knee replacements are a little bit more difficult, but they are on Medicare, Medicaid just put them on the outpatient list this year so they can be done as outpatients. Safely. And so hip, shoulders, and knees are really the 3 big ones.
Well, Dr. McCoy, once again, thank you so much for all of that wonderful information.
Well, thank you for having me. I sure appreciate it.
And for more information, you can go online and visit eastcoopermedctr.com.